Hello and welcome back to the latest episode of SageDucation. I am Dr. Zhang.
And I am Fast.
So during our last episode, we spoke about male pattern hair loss and the causes. The primary few causes are DHT and genetics.
And today we will be discussing the use of finasteride, which is one of the most crucial steps to take in treating or slowing down male pattern hair loss.
So patients we see a lot of times would have tried different therapies and they would have said that they didn't work or they don't work.
And when asked what do you mean by it didn't work, a lot of times the answer is I think it may have slowed down the hair loss, but I don't see hairs growing back.
So I guess the question would then be, if you stop the treatment, what happens next?
And the answer to that will be, it got worse. So the first thing I'd like to emphasize is preventing the progression of this condition is the first step to success when treating male pattern hair loss.
So what we're trying to do is to achieve stability, which means not losing more hair.
Yes, so for those suffering from male pattern hair loss, you have to understand that if you don't stop it or slow it down in its tracks, what's going to happen is that you're going to find yourself looking more bald in the next 1 to 2 years.
So as we have established from the last episode, male pattern hair loss is caused by genetics and DHT. And unfortunately, genetic composition is not something that we can do about.
Yes. So let's talk about the guy that we can do something about, which is DHT. So how does finasteride help? Tell us.
So if you remember from the last episode, testosterone converts to DHT via the enzyme 5-alpha reductase. And DHT causes the miniaturization of hair follicles in those people predisposed to male pattern hair loss.
Yes, so 5-alpha reductase, when it is reduced by finasteride, essentially decreases the amount of DHT in the body, which means less DHT, less hair thinning, less DHT, less enemy. So we are really preventing the entire process of miniaturization that way.
Well, so if you're worried about reducing your testosterone levels, you do not really have to worry because less testosterone being converted would mean more testosterone in your system.
So how much of that DHT are we actually reducing? I would say it's in the order of about 2/3.
So when you actually reduce your DHT, which is actually the enemy, you get to achieve the stability, which is what we spoke about just now.
That's right, and actually studies show us that about 86% of the male population continues to have that stability at the end of 1 year, which is quite a large number, I would say.
Right, but then you know what, it varies according to the individuals, right?
Of course, yes.
Yeah. So fast,
Yes.
Naturally the next question people would ask is, do you have to be on it for life?
Well, if the condition is progressive, which it is, and finasteride is actually helping to achieve that stability, removing that agent will then naturally cause a surge in the negative activity of the enzyme, right? So a lot of times what I tell our patients, I think you say the same thing, that you want to take it for as long as it matters, for as long as your hair matters to you. And I think for some people it's up to the time that they get married and have kids, and for others it's up to the time they're 70s. 60s, maybe?
Right. So our oldest patient is actually 73.
That's right.
So fast, in our experience, how long would you say the stability lasts for?
I would say really 4 or 5 years.
Right, so
Not longer.
So I mean, if we manage to actually delay the progression and maintain the hair, wouldn't you say this is success?
Well, I think for anyone who's suffering from male pattern hair loss, if 5 years later you have more hair than you would have had, that is essentially success, right? To a certain extent. Yeah.
But finasteride is still crucial with or without a hair transplant because it still helps to prevent and maintain your existing hairs.
That's right. So for those of you who are suffering from male pattern hair loss and it's causing you, a distressed state of mind, you need to understand that you do have a choice.
And actually, finasteride is a very safe medication. It only targets DHT at a specific pathway and doesn't affect any of the other organs. So it's actually really quite safe.
That's right. But are we saying that it comes with zero side effects?
Well, definitely every medication would come with its side effects.
That's
but for finasteride, the side effects are actually very minor. And even then, they are all actually reversible.
Yeah. So what we are saying here, or what we're trying to tell you is, you should seek the help of a medical hair restoration professional if you think you're suffering from hair loss, because there are a lot of inaccurate information off the internet about finasteride. So what we will say is, always the advice is to go and seek help from a medical hair restoration professional to understand if it is suitable for you.
And I mean, look, when you see a doctor or a medical professional, we would actually assess your condition, diagnose you appropriately, and give you the right amounts of medication so that you don't actually suffer any of these kind of unwanted side effects.
So in our next episode, we will be discussing the pros and cons of the use of finasteride, as well as the myths that are associated with it.
So I hope you find this informative and now have a better understanding of the available options,
as well as the importance of slowing down hair loss. Now understand, in summary, male pattern hair loss is a progressive condition, and taking a multi-pronged approach is the best way around it.
So till the next episode, we'll see you again.
Have a good one.